Hi, I'm Dr. Mia Duncan, and welcome to the Vaginal Channel. Here at VTV, we are your resource for all things related to pelvic health. Now, today, my pit bull, Sir Figgy Newton, decided that he wanted to join, and he is not going anywhere. So, hopefully, y'all don't mind if he hangs out with us today. We're going to be talking about when your doctor has prescribed estrogen cream for your recurrent UTIs and your low vaginal estrogen, and it's not working. Now, I've been doing this for years, and pretty much every time I hear a woman tell me the vaginal cream isn't working, I immediately think something is wrong, like it's not being applied correctly, or there's something up because it is really that effective. I almost can't believe it when I hear it. And so the immediate thing I want to do is try to troubleshoot what's happening. So if you're somebody in that situation, let me walk through some pro tips to figure out what is going on. The very first issue that I run into is number one, the person's not applying it in the right place. A common way for physicians to prescribe estrogen cream is to tell you to put a little dab the size of a pea on the tip of your finger and then apply that little pea right at the vaginal opening. Well, what happens sometimes is women will reach down and apply it this way without looking. And so their finger is coming down in between the labia and they're applying it accidentally near the clitoris. And that is not going to really help with recurrent urinary tract infections. And so, what you want to do is spread the labia and apply the cream right at the vaginal opening because that's where the urethra lives. There'll be a different video where I review that in a little bit more detail, but trust me that that is where the urethra opening lives. So if you imagine your vaginal opening like a clock and 12 o'clock is where your urethra opening is, you can imagine that the little opening that you pee from, the urethra, is part of the vaginal opening. So here's the vaginal opening right here. The estrogen cream has to go there in order to effectively prevent urinary tract infections. I'll be going over that in a different video. As for right now, that's the number one thing that I will typically see. The second thing is sometimes women have been prescribed estrogen in the form of a vaginal tablet. So, like a little pill or suppository that you're placing into your vagina, or a ring that's inserted into the vagina, and that ring sits there and gets changed out every 90 days. Those are the other two main ways of prescribing estrogen to the vagina. If I see someone that is on, say, the tablet or the ring and they're not doing that great, I will put them on the cream. And that's just because after my years of experience, what I've seen is the cream just works better. I mean, on paper, it should be the same, but ultimately, applying estrogen either with the little finger application method we just discussed or using an applicator. Again, separate video to go over that. That's just going to be the best way to do it. The third issue that we run up against is some kind of misunderstanding about what the estrogen cream was supposed to do. So sometimes I'll ask people, well, what were you thinking that the estrogen was going to do? And sometimes women think that the estrogen is going to resolve urinary leakage or other symptoms like getting up to pee at night. And unfortunately, it's really good, but it's not that perfect. And it's really just there to decrease the risk of urinary tract infections. So I check in with people to be like, hey, was there something else you thought was going to happen? And just make sure that the initial expectation the person had was set straight. The other thing that I run into would be a wrong dosage. So if a person isn't on enough, that can be a problem. The traditional dose of estrogen cream is going to be an applicator full into the vagina for 14 days and then an applicator full of it a couple of times a week. Or another popular method is just to take that little dab on your index finger and just put it at the vaginal opening. And again, right here. And if that is the method that you're using, but say you're only putting a little dab on the vaginal opening like one night a week or two nights a week, and you're still having problems with bladder infections or other urinary infections, then that's usually a sign that you really need to be on more traditional dosing. So sometimes it's just a matter of tweaking the dosing a little bit to make sure that we're getting the effect that we're looking for with the vaginal cream. In summary, if the vaginal estrogen cream isn't working when you're trying to reduce your risk of urinary tract infections, there's almost always some kind of technical issue. One, you're applying it in the wrong place. Number two, maybe you're not using the best formulation for you. Number three, maybe there was a misunderstanding or miscommunication between you and your doctor as to what that cream was supposed to do. And lastly, using the wrong dose for you. Again, there may be some people who can use just a tiny little bit of the cream once a week and be fine, and other people need more traditional dosing. So, I hope that if you're dealing with recurrent UTIs and you're using estrogen cream, but maybe weren't getting the result that you wanted, this helps clarify some of the troubleshooting you can do at home to figure out why it's not working for you, because it honestly should be working for you in the majority of cases. Estrogen cream is a huge help for infection. So again, if it's not helping you, then that's a sign that maybe again there's a technical issue. I hope this video has been informative for you, and if you liked it and found it useful, please subscribe to my channel for more content on public health, and hit the bell so that you can be notified about episodes when they go live.